Right. Hello, John Smith.
Yeah,
Hey, John, how are you? My name is Camilo. I am the treating physiotherapy today. How are you today?
I'm good. Thank you very much.
All good. John, just to know that I'm with the right patient and for safety precautions, can I ask your full name, date of birth, and age, please?
Oh yeah,
You can say whatever you want.
I'm John Smith,
Yeah.
born XY. I'm 55 years old.
Ah, that's great. That's great. Well, as I told you, my name is Camilo. I am the treating physiotherapy today. Is that all right for you if I sit here while
Yeah,
we have
it's
this
no
session?
problem.
All right, cool. John, you can see here this is an exam situation. There is my two assessors there, X and Y. Is that all right? They are assessing me. Is that all right for you?
Yeah, it's no
You don't have any problem with that?
No.
That's great. Um, yes, John, so my session is gonna be around 45 to 50 minutes. It's gonna be split in three parts. First part is gonna be me asking you a few questions just to get the history of what happened to you and why you're here and what you want to achieve. Then I will do some hands-on assessment. We will be, you and me, setting some goals. And then, yeah, we will do some exercises. How does it sound to you?
Oh, it sounds good. Yeah.
Sounds good? All right, good. Um, yeah, John, let's start from the beginning because I got from the your neurologist refer you to my clinic today because 4 months ago you had a problem, an infection in your
Yeah.
gastrointestinal tract,
Yeah.
and after that you had to go to the hospital because you developed Guillain-Barré syndrome.
Yes, that's
Yes?
right. Yeah.
All right. So just to build the timeline, you got the infection. How long did it took to you to go to the hospital in average,
Oh, I don't
roughly?
really remember. I think less than a week because I was in Bali and we just moved straight away to Melbourne.
All right.
And then in there they checked on me and they were like, no, they brought me to the Melbourne University Hospital.
Hospital. So you went into the hospital, and what brought you there to the hospital? Why did you, you know,
Oh,
went to the
well, like,
emergency?
and then when I was in Bali, they were like, oh, that's just a bug or something like that. So I was feeling not alright at all.
Mm,
But then, like, I start feeling very weak and
like generalized weakness,
yeah,
or was
very
it?
generalized, but then especially on my legs,
All right.
it was coming up and like I started having problems like even breathing. So
Ah, okay.
yeah.
So that brought you to the hospital.
Oh yeah, they brought me to the hospital straight away.
And what happened at the hospital?
Oh,
Starting from how long did
I
you stay at
stayed
the
in the
hospital?
hospital for I think about 3 months.
3 months. All right. Let
Yeah.
me take notes from that. All right.
Yeah.
Just let me do a quick pause. Sorry, buddy. Sorry for that. Was somebody that was knocking on the door. Everything is all right. So you spent 1 month at this hospital.
Yeah, and 2 months in rehab.
All right. So 1 month at this hospital, and then 2 months and at the inpatient rehab.
Yeah.
Rehab. That's great. So it's been 3 months, and then what happened during this time in the hospital? Did you need like respiratory support?
Yeah,
Did
I
you
was
had
like under a ventilator for a bit.
did you had any chest infection on that?
Like I know that like I couldn't breathe, so I had to be put in ventilator. I had an infection, so
Yeah.
yeah.
And after that, when you went to this rehab, inpatient rehab, um, how was that? I mean, did you? I probably they did. Lots of exercises. Did it went
Yeah,
well?
like definitely a lot of exercises.
Mm-hmm.
I tried to exercise as much as possible, but there was the fact that I got weak quite soon. So
Because you spent like 1 month in the hospital,
yeah,
and then 2 months in the inpatient rehab, and as soon as you get out from this inpatient rehab, you went straight home.
I went home, but I was getting physio with this other lady, Marie, but now she's on maternity leave and they refer me
They
to
refer me. They refer you here. All right. So you have been going with Mary, the other physio, for 1 month.
2 weeks. Yeah.
Yeah, 2 weeks. All right. So it's been 2 weeks since you started with Mary. Sorry that I'm taking notes so I don't forget this timeline. And as soon as you went out from the hospital, what were you able to do?
Like I could walk.
Mm-hmm.
So
Sorry if I interrupt you in the middle, just to clarify a few things. Were you using like a.
I got this cane now.
Alright,
And
you've got one cane here
yeah,
that is
yeah.
close to you. Cool. Are you okay with that?
Oh yeah, like when I'm inside now, most of the time I don't use it,
Alright,
but outside I always take it with me.
okay.
Yeah.
Alright. I'm gonna just pop back a little bit so I can start building the story because I don't have much information. So, do you have any other medical conditions that you are aware of apart from this GBS that had got you to the hospital?
Oh,
Like I don't know, maybe any heart condition, any problem with the lungs, or
no,
no?
no,
No. All right. So you are taking. Were you taking any medications before going to the hospital?
no,
No. Any medications on a regular basis? Not at all.
no,
And what about after the hospital? When you after this GBS, did they leave you with some sort of medication?
no,
No. Do you have any allergy that you could be aware of?
no.
Not at all. All right. Um, just to make the big picture, do you live in a single story house, double
Yeah,
story house?
single story.
Single story house, and do you have steps or ladders to get
No,
in and out of your house?
no.
No. So, has any OT or occupational therapist assessed your house for, the suitability?
Yes.
Is it safe? They already assess it?
Yeah, like the house
Alright.
is fine.
All right. Have you been having any sort of problem with your speech or your, swallowing problems?
No,
No.
no,
Okay. So you have no experience before, like any choking, coarse voice, or
no,
problem
not
with your
really.
swallowing?
No.
Was that mine? Again? Sorry, mate, I'm not here. All right. So not a problem with that on that end. All right. Um, you live with your wife at home? Who
Yeah,
do you live with?
I got my two boys and my wife. Yeah.
Alright, so your wife is working full time? Is she
Yeah, she's working.
working? Wife plus working. And your kids, how old are they?
They teenagers. One is 13, the other 17.
Ah, cool. So, um, is your wife able to give you a hand, sometimes?
They've been great. Like they've been helping me a lot.
Alright, so that's good. That's good. You're coping well with that as well.
Yeah.
Cool, that's great to know. Do you think you are needing any sort of assistance on your house, like I don't know, getting in and out of, the shower, the bathroom?
Oh
You're
no,
managing
no,
well.
no.
All right. I don't have information in regards to your job. What do you do for a living?
I'm an administrator of a agency that real estate agency.
All right. You work at an agency. Does it involve like a lot of sitting, or is more like a on-site job?
I do a bit of both, but I'm in the administration, so I spend a lot of time in the office. But like I pretty much manage my time the way I want. So sometimes I get out, sometimes I
And at this point, are you still working, or are you on a leave?
I'm gonna leave just because I want to get much better.
Mm-hmm. To get back to work.
Yeah,
And
yes.
is that alright for you? Having, keeping yourself on a leave, is that alright? There's no issues at all on
Yeah,
that end?
yes.
Alright, cool. And may I know, if you don't mind me asking, do you have any hobbies, something that is important for you to do?
Oh well, I used to go running. Yeah,
Running. Cool.
quite a lot. Yeah.
How long did you used to run?
Oh, I've done a few marathons.
Few marathons, so
Yeah.
like 42Ks?
Yeah.
Cool. So you're a runner.
Yeah.
Alright. And is anything else that like to do at home and stuff like that?
Well, I consider myself pretty active, but I would, watch go watching the boys' games or
Yeah, sure thing.
like spending time with family.
With the family.
Yeah.
I can get that. I can get that certainly. All right. So let's move now to your level, your current level of function. So you told me that you were able to walk inside your house and use your cane every now and then, not very often inside the house.
Yeah.
So you used to hold on onto the furniture, or how do
Oh,
you do
as I
it?
said, like the there there are some proper furnitures around, but even some handles.
Yeah,
So it's quite alright. I mean,
it's quite easy for you to
yeah.
move around. And what about when you go outside, like if you have to go to the shops
I
or?
just use the cane and
All
I
right.
can walk. I mean, I can walk quite a long. I mean, we got these shops. They probably are 120 meters, 150 that can go in there and back.
Walking
Yeah,
with your
walking, but
cane.
yeah, but it gets really uh, exhausting as activity. Like,
Yeah.
yeah, that's the main issue.
If you would be able to tell a number from 0 to 10, whereas 0 is not tiredness at all, not exertion, like being at rest, and 10 is I cannot give one more step. I'm exhausted. How would you rate walking these 120 meters, 150 meters back and forth? How would you rate that exertion?
Probably we get to 6 or 7.
6 or 7. So then what do you do for settling down? Do you have to take a rest? Do you have
I
a
just have a pause, like I stop,
but
I
you
sit around.
sit around? All right, good enough. Yeah. And how long does it take to get back? You get your breath back. How long does it take? I don't know, maybe 2 minutes,
It
1 minute.
depends in terms of the distance that I've done. Like, so if I got to walk around the house, sometimes like I do 20 meters, then I rest for a minute, and then I'm fine.
Easy. Cool.
But if it gets like more, like it's a problem.
All right. I get the point. That's fine. Yeah. So you don't need anybody that gives you a hand with the walking. So have you found any problem with your balance, or you know,
But with my balance, no.
not
Well,
really?
like I'm a bit wobbly at the beginning.
Yeah.
Like so I stand up and I get to, like so I never fall and.
So probably from what I can see, the main problem is that the fatigue is there. So the muscles are probably not, getting back used to do some exercise,
Yeah.
and that's why probably we will need to work on that to get you moving better and get you moving, get you stronger and build on that endurance of the muscles.
Yeah.
Yeah.
Definitely.
So I just want to rule out a few red flags, some things that will need to get further assessment in case we find something. All right.
Okay.
Have you ever experienced in this after you get out of the hospital any sort of sudden weakness in one side of your body,
No.
pins and needles, numbness?
Oh well, I had pins and needles and numbness like before.
Before the hospital?
Like yeah, even during at some point at the moment, nah.
No. So that was solved.
Yeah.
All right. Numbness in any side of your body,
It's the same as I just said.
pain,
No, that's really
no? Any
painful.
unremitting pain, something that happens all of a sudden and it's like a big pain, something that you're not used to, no?
No.
Any weight loss in the last couple of weeks,
No.
no? Any sort of headache, like unremitting headaches, no? Night sweats, chills, fever,
No.
any problem with your bowel and bladder,
Oh
sort of incontinence, no? All right. Any signs of infection in any side of your body, like I don't know, redness, like behind the knee or in the calf?
no. No,
No.
that's really
All right. Cool. So probably from what I can see, there is no things to be worried of, which is great. I just want to know, John, what are your goals for today? What are you expecting to get from today's session?
Oh, well, like I'd like to probably get back to maybe to running
To
to.
running. Yeah, that will be great.
Yeah.
Probably. Yeah, but you look, John. This is something that we certainly will keep in mind, and
Yeah.
that probably is gonna be like a sort of a long-term goal. We will build up on your endurance, your strength,
Oh,
and
okay.
then get you back to the track of the running side. But probably that's looks like a sort of a long-term goal. How
Okay.
how does it sound to you? Like a sort of a long-term goal.
Okay. Yeah.
Sounds good.
Yeah.
All right, and but if you can tell something that you want to achieve just from today's session, what would it be? What aspects are you
Maybe
willing to?
maybe manage a bit better this fatigue.
All right. What about if I teach you some sort of techniques and tricks to manage this fatigue and maybe try to get this fatigue a little bit later or walk a little bit further and not feel so fatigue and teach you some techniques that allows you to when you feel this fatigue manage this a little bit better.
Okay.
How does it sound to you?
It's feel alright.
All right, and is there something else that you want to add for the goals or expectations that you had?
Well, at the moment, I would like just to get better. Like I'd like to go back to my normal life and do
Cool.
the things as before. Cause
Thanks, John, for sharing that with me. We will essentially keep that in mind. That's going to be some sort of adding to our long-term goals. Sounds good to you?
yeah.
Great. Next thing that I want to do with you, John, is we are going to do some hands-on assessment. Okay? I know that you walk with your cane, and your cane is here somewhere. So yeah, let's pretend it's there. Pretty good. Yeah, I would like to start because we don't have any baseline assessment. So I just want to check quickly check. Have you experienced any vision problems? Any problem with your sight? Blind
No.
color blindness?
No.
Not at all.
No.
Can you see my hand properly? No double vision, no blurred vision.
No.
All right. What about hearing problems? Have you experienced any hearing problems?
No.
Not at all. Can you hear properly? Like if I do this, same as this?
Yeah.
Pretty good.
Yeah.
Not a problem at all.
Yes.
Do you have any problems, bending or twisting your head or bending back and forth? No. Any radiating pain in any side of the body?
No.
No? Cool. Great. I just want to assess your sensation. So, because I know that Guillain-Barré usually start from distal, which is the distal part of our limbs, to the proximal part. So I just want to know how is your sensation going. Because this is a lower motor neuron disease, I would like to go with dermatomes. Is that something that I'm gonna do this, and you can let me know if this feels the same, in one side
Okay.
of the body. All right. So close your eyes, and I'm going to touch here, and you can let me know if does it feels the same.
Okay.
Feels the same?
Yeah.
Yeah. Like if you could tell, like 100%, 10%, how do you feel?
100%.
100%. Cool. So here's the same.
Yeah.
Here's the same.
Yeah.
Here's the same.
Yeah.
Here's the same.
Yeah.
Here's the same. Can you put palms up for me, please? Here is the same.
Yeah.
Here is the same.
Yeah.
Cool. Great. I'm gonna do the same with your legs. Here is the same.
Yeah.
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 Yep. And about here.
Oh, yeah.
Here.
Yeah.
No problems at all. In the middle of the foot. What about the sole?
No, it's alright.
It's alright. Same.
Yeah.
And the back of your thigh. Feel the same?
Yeah.
No sensation alteration. No
No.
problems in the sensation. Cool. Have you feel any weakness in the lower extremities, upper extremities?
Oh, definitely they weaker than before. Yeah.
Yeah, sure thing. Can you please raise your arms up for me, like so? All right. What about to the side here? All right. What about the elbows? Flex and extension of your elbows.
Yeah.
Twisting your hands like so, and open and closing your hands. Any pain with that?
No.
No? Cool. Let's do something. I want you to do the chicken wings and don't let me push you down. Okay, just a little bit of weakness, which is good. Can you do the same like so, trying to lift your arms up? All right, there is no change in any side, so it's pretty symmetrical. We're going to do the same with your elbows, all right? So don't let me push you down. Don't let me push you down. Try to flex your knee. Sorry, your elbow. All right. What about the left side? Don't let me push you down. Don't let me push you down. All right, one more time, please. All right. Going to do the same with extension, all right? Don't let, or what I mean is try to push my hand. Push my hand. Push my hand. Push my hand. All right. What about the right side? Push my hand. Push my hand. One more time, please. All right. I'm going to take quickly, because you are in a safe position now, I'm just going to take my dynamometer here. And yeah, we can use this dynamometer here. I just want to assess how's your grip strength. Can you please squeeze the hand so hard? Cool, I got the measurement there. That's 10 kilograms. Squeeze, 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 squeeze. Yeah, 8, 9 kilograms, which is pretty much the same. Are you left-handed, right-handed?
Right-handed.
Right-handed. Okay, that's why you got better squeeze on that side. We're going to do the same with the lower extremities. Okay? Can you please bend the hip like so? The right and the left one, and strengthening, straighten the left one. All right. What about the toes? Can you wiggle the toes like so, up and down? All right. What about the left one? Cool. Now I'm going to ask to lift up the right knee up. All right. Push my hand. Push my hand. What about the left one? Push my hand. All right. One more time, please. All right. What about the knee? I'm gonna ask you to straighten the knee. Push it down. One more time, please. Okay. It's gonna do the same with the left. One more time, please. All right. Going to do the same, but now you're going to flex the knee. Put your feet down. All right. Feet down. One more time, please. Right. Place the same. Push my hand. One more time. Great. With your right foot, press my hand. Press my hand. Wow, that's good. What about here? Press my hand. One more time. All right. What about here? Press my hand here. One more time, please. All right. Left one. One more time. All right. As you were telling me, there is weakness up extremities and lower extremities, which is something that we can expect after spending, almost a month in the hospital and then inpatient rehab. And because you haven't been moving much in the last time, that's something that we are going to expect. But the good thing is that you were very active before, and because you were a runner, you were doing a lot of exercise. So what we need to do is just keep working on giving, the information of from the brain and start to regain this muscle control, regain the strength, and as much as the more we do, the better you're gonna be. You know what I mean?
Yeah.
Do you have any questions so far? No? Cool. I'm just going to ask you to use your cane and show me how do you stand up from the chair. All right. I can see just a little bit of wobbling. Just twist it up a little bit. All right. Can you do some marches on the spot for me, please? Yeah, this is something that we can expect. Did somebody assess this or measure this cane for you? Did the physio did that for you? Because what it should happen is that if you keep your elbow flexed like 15 degrees, the handle should be like in the wrist rest. All right. So just let me try to adjust a little bit, and probably that's gonna be better for you. Are you feeling fatigued now? A bit tired?
A little bit is tiring.
Dizziness? No? Lightheadedness? Not at all? Alright, can you give one step forward for me? 1 and 2, and step backwards, please. Alright, can you please lift one leg, lift the other one? Alright, that's alright. I want to come with you, John, and go to the gym area. If you start feeling like fatigue or that you need to have a rest, just let me know, okay? We're going to do something that is called the 10-meter walk test. I just want to assess how do you do in these 10 meters. I know this is a really small, this is not long enough for you to, accept you, but I want to assess your gait first, and I would like to know how do you do in this, in terms of how do you manage your fatigue in these 10 meters, all right, and how long does it take to you to get there, all right? So let's go to the gym area. I don't feel like you need a pelican belt. I mean, this is my first session with you, but you already told me that you were safe walking around, so I'm not concerned of that. Okay, so can you have a seat here, please?
Of course, yeah.
All right, have a seat here, John. So what we are going to do now is you are going to walk to the 10-meter walk, sorry, the 10-meter mark that there is, you can see that there is there at the back of the gym area.
Yeah.
So what I want you to do is, when I say you go, you're gonna stand up and walk as fast as you can, but in a safe pace, all right? Okay. I'm gonna be standing just slightly behind you, just in case, and my assessor, my helper is gonna be on your side, okay?
Okay.
Good, do you have any questions? No?
No.
All right, so let's take the time. 1, 2, 3, go. Gonna be the 10 meters. Go to the 10 meters.
Okay, I passed the
Yep.
10 meters.
All right, so you can have a seat there because we already put a chair there. You can have a seat here in the 10 meters.
Yeah.
Okay, how did it feel?
Oh, it's alright, yeah.
All right, I didn't catch any guide deviation. I mean, you're doing good toe pattern, so toe heel contact, then toe off pattern. Your swing was good. It's just that I can see there is a weakness in your lower limbs, which is, obviously again expected, but that's something that we are going to work on. Yeah, I mean, how long did it took?
Let's say we've done it in 18 seconds.
18 seconds. And what is your level of fatigue doing this?
Probably a 3, 2 or a 3, yeah.
3, which is not too bad. I mean, it's all right. All right, how are you feeling now?
I'm alright.
Are you feeling all right?
Yeah.
Cool. So what are we doing now is that, I don't know if the physio gave you some home exercise program. Did they give you some exercises to do at home?
Something, yeah. Something.
All right. Do you remember them? Have you been doing them at home?
I got this kicking
All right.
exercise. And then there was this exercise like going up.
Okay. And are you doing them?
Pressing them.
Are you doing them well at home? Are you managing
Yeah,
well?
like I'm trying to do them sometimes. Yeah.
And sometimes mean that you do at least once a day or every now and then?
Yeah, I suppose at least once a day.
All right. So probably it will be good idea to do at least 2 times a day, and at least walk like, I don't know, maybe 10 minutes.
Oh, I try to walk every day.
All right. Good. Keep on that. And because, as I told you, the more we do, the better we are. You know what I mean by that? I mean that if we keep giving the input and the information to the muscles to start working again, it's going to get stronger and working on the endurance as well.
Okay.
All right, so that's what we need. We need to get you stronger and make the muscles get more endurance, so you can, how can I say, bear, the daily activities in a better way.
Okay.
You know what I mean by that?
Yeah.
All right. So if you have any questions, just let me know, all right?
All right.
What we're going to do is we're going to do exercises for your lower extremities, because this is going to help you to regain your independence. Okay? So I just want to know a few things before we go on the plinth and do some exercises on the plinth. Okay? I would like to assess your coordination and your balance. And for that, I just want to make sure, because I'm not expecting any problem with your coordination. Probably this is because this is not a upper motor neuron disease, this is a lower motor neuron disease. But just to have the baseline assessment, I would like to get to know how is your coordination going.
Okay.
All right. So have a good seat on the back. Get rest. Are you feeling comfortable there?
Yeah.
Okay. So if you want to lay back, yeah, like so. Get yourself comfy, and we're going to do this with your finger. You're going to touch your nose and then touch my finger,
Okay.
as fast as you can. All right. Start with the right, but really fast, as fast as you can. Can you do it faster? I know it's probably a bit weak, but that's great.
Yeah.
That's fine. Let's do it with the left one. All right. Easy. Super good. Close your eyes now, and you're going to tell me if your thumb is up or down.
It's up. It's up. It's down. It's down.
All right. Let's go to the right side.
It's up. It's up. It's down. It's down.
Great. Good job. We're going to do the same with your legs. All right. So I just want to make sure you know what this is up and this is down.
Okay.
All right. Close your eyes, and you're going to let me know if this is up or down.
Up. It's down. It's down. It's down.
Cool. Let's go to the right side.
It's down. It's down. It's up. It's up. Yeah.
Great. And the last one, I want you to do with your right leg, your right heel, to make a line like so. You know, as fast as you can. Jesus Christ.
And go with the other one.
Fuck. Just give me 1 second. Sorry, mate. Somebody's at. Sorry again. Somebody else was at the door. So we were doing these exercises here just to assess your coordination, and I can see that there is no problems at all with that. I just could see that, there is some weakness, so we are going to work on that. Okay? So can you take please your cane?
Yep.
And walk with me? I just want to double check your walking, that there is no problem. All right. All right, what we're going to do now, John, is look at me. We're going to, now that we're standing in the parallel bar, I want you to get rid of the cane and start working. If you need to hold on the parallel bar, that's fine, all right? But we are going to work on the heel touch pattern, which is trying to make heel contact in your first step, all right? Then you're going to focus on the toe off pattern, meaning that when you step through with the other leg, you want to make sure we are doing like so, like bending the hip, bending the knee, and giving the step a little bit further. All right?
Okay.
Can you understand what I am saying?
So
Sort of.
Yeah.
Let me show you. This is the parallel bar, so I want you to exaggerate a little bit your steps. All right? So make these and make this like bending the hip, bending the knee, and giving the steps a little bit further. Okay?
Okay.
Can you do that for me? All right, we're going to do just 5 with the right and left, 5 right and left.
Like that?
Yep. That's great. And you're going to do the same going backwards. Yep. Yep, now you need to touch with your feet and go back. This is also good for your proprioception and balance and working your core muscles, your hip muscles. This is not only working on your gait, but you know it's getting your muscles working again. All right? So get to the end of the parallel bar.
Yep.
All right, and we are going to do the same again. Steps, like exaggerating the steps back, sorry, forth, going forward.
Okay.
Great. Are you feeling any pain with that?
No.
No? All right, and do the same going back. Right, that's a good job. All right, feeling like you need to have a rest?
No.
Are you okay? All right, let's get out of the parallel bar. Get out of the parallel bar. Here is your cane. And what we are going to do now is put this in practice. All right, what we have just done here. Try to make the step a little bit further in the front of you.
Okay.
Trying to land with your heel, and then with the other leg, try to go a little bit further. Does it make sense?
Yeah.
All right, go for it. All right. All right. Now remember that the cane that you are using on the right has to go in line with the left leg. All right, what does it mean? As soon as you move your left leg forward, same with the cane.
Okay.
All right, and then with the right leg, you step through, and then comes the left leg that comes together with the cane.
Okay.
All right, put that in practice. Great. All right, good job.
Yeah.
Great, let's go to the plinth now. Go to the plinth. Remember to put that in practice. And here in the plinth, we're going to do some exercises. We're going to start doing some bridges first. You know, have you done bridges before?
For.
Yeah, it's for getting your muscles of the bump muscles, you know, glute, stronger.
Okay.
So we're going to do that 10 times. All right?
Okay.
If you want to lay down on the plinth,
Okay.
flex your knees. Just gonna put one pillow under your head, so it's more comfortable for you.
Yep.
Feeling all right there?
Yep.
All right. So bend your knees a little bit up, up, up. All right. And try to lift your bumps off of the plane. Up. Yep.
Yep.
Up as you can.
Okay.
Go, 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 go. Up, 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 up. Great. One. Let's do something because it's a bit difficult for you. Try to bend a little bit more your knees.
Okay.
That's probably gonna help you. Is it better?
Yeah, it's alright.
Not pain?
No.
Alright, this is the first thing that we're going to do at home. It is called bridges.
Okay.
Alright? So try to do this 10 times, please, for me.
Okay.
This is 4. If you're able to hold for 3 seconds, up.
I don't know.
You don't know? It just feels weak, probably.
Yeah, it's a bit wicked.
Alright, this is 7, 8, 9, and the last one. Alright. While while you are in this position, I'm just going to make sure you have a pillow. You can use a pillow at home. Try to squeeze your knees together here, and while you are in this position, try to straighten the leg, the left and then the right. All right?
Squeezing.
No. What I mean is, while you're squeezing the knees together, I want you to raise your leg like so. All right? You're going to do with the left and then with the right. One. One with the left. Remember to bring your toe up.
Okay.
Yep, like so. Yep, toe up, so we get a better contraction of your quads. Okay? Move this thing here. Now you can see the patient here. All right.
Yeah.
How does it feel?
That's right. Yeah. It's hard.
It's a bit hard, but we're getting there. I mean, this is what we need to do in order so the muscles start, getting stronger and regaining the endurance. All right. One more time, and just to get the 10 each side.
Okay.
All right.
Yeah.
Great. So, second exercise is going to be this one.
Okay.
The first one is going to be the bridges. Second one is going to be this one. All right. And the third exercise that I want you to do at home is going to be standing up. Okay. Just these two on the plinth, and then you can pop over, close to probably a furniture or a chair. It's fine for you. So if you want to step out of the bed, please, John. How are you feeling?
Yeah, it's alright.
Tired?
Yeah, a little bit.
A bit tired? Are you feeling like you need to have a rest?
No.
No? Okay, you can stand up and hold on from here.
Yeah.
All right. Now that your legs are pointing straight forward, make sure they are pointing straight forward. We're gonna do the calf raises and then toe raises. All right? It's gonna be, that's good, and then the toe raises. All right, 10 times. It's gonna be like that, like so. Up, and that's one.
Okay.
Up and up, that's two. All right, make sure to get as much as you can, as high as you can on the heel and then with the toes.
Okay.
Make sense to you, John?
Yeah.
All right. That's 7, 8, 9, and 10. Good. This is the third one, and the last one that we're going to do is going to be squats. All right? This is all focused on the lower extremities. This is all that we're going to do, getting your muscles stronger, and again, getting your endurance back. All right? So, while you're holding on to that chair, you can do some squats. So 10 times squats as far as you can. Hold on 1, 2, and then going back. Go back. Do you think you can do that?
Let's try.
Let's try.
A bit tired now. Yeah.
Probably. That's 1. That's 2.
Okay.
I'm just gonna make sure you got a chair close to you, just in case.
I don't know if I can get to 10.
Alright, that's fine. You can have a rest. Go back. How is your number now from 0 to 10 on your fatigue?
5,
At 5.
6.
That's beautiful. That's what we want. Alright? We want to keep you between 5 and 6. Don't go over that. We don't want to overexert you. But certainly we need to challenge your muscles and your system a little bit. Does it make sense to you?
Yeah, it's alright. Yeah.
It's all good? Have you been doing some stretches after exercises? Do you feel like you need some? Are you feeling like any sort of stiffness in your back, in your buns?
Sometimes I was cramping a lot of calves, yeah, back in the days.
All right. So I just want to show you one thing that you could do with that, which is some calf stretches. You're going to hold one bell, put it around your. If you want to straighten the leg for me, please. You're going to do this. Right, with your hands. You can pull and get a good stretch in the back of your calf. Does it feel? Is it feeling? Alright, you can hold that for 10 seconds and then do it with the other leg. 10 seconds and then you can go to the other leg. Hold that for 10 seconds and that's going to be a good stretch on your calf. Alright? 10 seconds, 10 seconds, 10 seconds, 10 seconds. So it's going to be 10 seconds 2 times each.
Okay.
Make sense?
Yeah.
Alright. Cool. Are you feeling this stretch in the back of your calf?
Yeah.
Make you feel better? Not pain at all at the moment?
No.
Did you catch your breath back? Like, how is the number now?
Yeah, we see 4 or 5
4
sometimes.
to 5. And what about now that you already had some sort of rest?
Yeah, it's alright. Yeah.
What number could you tell?
Yeah, just see 4 or 5.
4 or 5?
Yeah.
Alright. So I want just make sure you have a good, proper, rest here. And just to wrap up everything that we have chat today, we have, the conversation that we have today. The first exercise that I want you to do at home are the bridges. Then squeezing the knees together. You remember that?
Yeah.
Straighten the knee. Then you're going to stand up and do some calf raises and toe raises.
Yeah.
10 times as well. And if you need stretches, stretches.
Okay.
Alright, so it's going to be 4, just 4 of them.
Okay.
Also, I want you to do these at least 2 times a day. That's alright for me. Probably early in the morning and then in the afternoon. Have a good rest in between. And probably if you can have a walk 1 or 2 times a day, that's also really good for you. And try to keep your level of exertion between 5, not over 6. Between
Okay.
5 and 6, it's fine. Alright?
Yeah.
Sounds good to you?
Yeah.
Do you have any questions that can come up from the session today?
Not at the moment.
No? Alright, I just want to make sure to reassess your gait. This is the final assessment of the gait, and that's it. Alright? Cool. I'm gonna give you the cane, and I want you to walk back and forth and put in practice what we have learned today, like putting, heel contact and do a proper stride length with the left one and then with the right one. And remember, the cane goes with the left leg, and then the right goes forward, and then again cane with the left leg, and so on. Alright?
Okay.
Go for it.
Okay. So.
Cane with the left, cool. Great. How is your level of exertion? Are you feeling?
Oh yeah, it's better. Yeah, I mean like 3 to 4, something like that.
Alright, fair enough. You can have a seat now. I just want to make sure you don't have any further questions or anything that you want to ask me.
No, it's alright.
It's all good.
Yeah.
It's gonna be a good idea if you come because I want to see you like 2 times a week. So today is Friday, probably we can start on Monday, and then Thursday probably. Sounds good to you?
Yeah, it's alright.
Cool. No questions?
Thank
All
you.
good.
Thank you very
All good,
much.
John. Thanks for being my patient.
Thank you.